Hello, good afternoon. Welcome to Contraceptive Matters with DKC Nigeria on Lagos Weekend Television on DSTV 256. This program is made possible by DKC Nigeria, one of the largest and private providers of contraceptives and reproductive health products in the country. And what we do basically on this show is to encourage families, sexually active persons in the public to embrace healthy lifestyle, to make informed and smart choices when it comes to contraceptives, child spacing method, and reproductive health products, thereby reducing not just maternal mortality rates in the country and in the world, as well as reducing sexually transmitted diseases the world over. I'm Olasumbo Mudupe. Please stay with us. The program continues in a moment. All right, thanks for staying with us. The program is Contraceptive Matters with DKC Nigeria, and today we are talking contraceptives as usual. We are looking at one of the hormonal form of child spacing method. We have two types of methods. We have the hormonal and the non-hormonal, but today we are looking at hormonal method, and we are precisely we are looking at implants. We have implant from the stable of DKT Nigeria. I have with me in the studio Dr. Tosin Laleye, who is going to discuss more with me about this particular brand and this particular method. Welcome to the program, Doctor.
Thank you. Good afternoon, Sumbo. How was your week?
Thank God.
Good afternoon, viewers at home. It's good to be back in the studio.
Okay. Today we are looking at implants. What makes implants different from other contraceptives?
All right. Thank you very much. Like you said in your introduction, the implant is an example of a hormonal type of contraceptive. And in this case, it contains just one hormone.
Okay.
That's the progesterone hormone. So this implant just consists of a rod, which is about the size of a matchstick, not too long. And it's usually inserted under the skin, just under the skin, beneath the skin of the upper arm. We usually say that the insertion should be done in the non-dominant arm. So if you're right-handed, that means it will put on your left. Well, not surgical in that sense, no. The way it comes, it comes with what will be used to insert it under the skin. So it's just right under the skin. We call it just below the dermis. That's the skin exactly. So it's not like cutting deep into the skin, no. So the applicator will just be used to introduce it beneath the skin.
Okay.
Like I said, so it's there, and how it carries out its action is that it is there, so it's releases the active ingredient little by little. It releases little at a time, and that carries out the action. And there are actually two types from DKT. We have the Implanon NXT and the JADELLE. The Implanon NXT lasts for a period of 3 years, while the JADELLE lasts for a period of 5 years. So it's inserted under the skin, and it releases the active ingredient little at a time, and it helps to prevent pregnancy for as long as 3 years for the NXT and 5 years for the JADELLE.
Okay, and we have the same hormones in each of them?
No, there are actually two hormones. In one, we have the levonorgestrel, and the other, we have the ethnonorgestrel. Well, I just didn't want to mention those names because viewers at home. But just know that they are progesterone hormone. This contraceptive method is actually an example of progesterone-only type of contraceptive.
All right, so who can use this particular method? Can anybody just walk up to the pharmacy or they walk up to any health care provider to adopt this method?
Okay, thank you. Like we usually say, apart from the condoms and the emergency method of contraceptive, most of all these other methods actually require a prescription, because you need to go into the health facility, you discuss with the health personnel, they take your history. Taking your history has to do with asking you about certain things, because for this particular method, well, this method can be used by any healthy woman. But generally, if you have certain conditions, it is not advised that you adopt this method. For example, if you have a family history of breast cancer, or you've had breast cancer in the past, or currently have breast cancer, it's not advised that you use this method. If you have any liver disease, it's not advised that you use this method. If you are obese, it's not advised that you use this method. There are other methods you can choose from. And with any liver disease, high blood pressure, we usually do not advise that you adopt this method. So for this reason, it's important you get to speak with your healthcare provider who listens to you, takes your history, finds out whether you have any of these conditions. In addition to the ones I've mentioned, if you have an undiagnosed vaginal bleeding and all, it is not recommended that you use this method.
Okay.
But basically, if you are the type of woman who is free from these conditions I've mentioned, but you are the type of woman who may not remember to take a daily pill, who may not want to bother about taking an injection every 3 months, then this method is it's the method to adopt. And one of the very good things about this method is that it is very reliable. In fact, studies show that the reliability of this method is about 99.9%.
Okay.
That's almost giving it 100%. It is very, very reliable. And another good thing about it is the fact that the hormone is released gradually into the body. It's not like it is stored up in the body for a long while, such that when the woman is ready to get pregnant, she may need to wait a while. This method is so good. It's good such that whenever you are ready, all you need to do is just take it out. There's usually no delay in return of fertility for the woman, because the hormone is released little at a time. It's not stored up in the body.
Okay, I have 2 questions now. If you're a nursing mother, can you use this method? Can you adopt this method? Then 2, can you combine it with other methods?
Okay, thank you very much. For the first question, if you are a nursing mother, yes, you can use this method. As long as your baby is up to 6 weeks old, you are free to adopt this method. Then in terms of, unlike when we spoke about the injectable, you know, we said that if you are not getting it started when you're on your period, if you are doing it at any other time, you need to adopt a second method of protection. With this method, it is not like that. Once it is inserted, it starts to work. So you don't need to bother about maybe doubling up with a condom over the first 7 days or anything like that. No. Once you get it inserted, it starts to work.
Okay, so what are some of the benefits of using this method aside from being a child spacing method? Are there other benefits?
Well,
Because, unlike some methods we've treated in the past, I know they have dual purpose and all that. So are there other benefits?
Well, majorly for this particular method, it is the implant is majorly used for its contraceptive action. It doesn't, it's usually not recommended for other things. It's basically used for its contraceptive purpose. And some of the advantages I've mentioned earlier on, number one, it can protect you from unwanted pregnancy for as long as 3 years to 5 years, depending on which of the types you adopt. It's convenient. Like I said, it's inserted under the upper arm. Nobody knows it's there. In fact, sometimes you yourself may even forget that you have it on. It doesn't give any discomfort. You are comfortable with it. You have no cause to fear. And it is very reliable. It is very, very reliable. And by the time you're ready to have a baby, you don't need to wait for any period for its effect to wear off. Once it is taken out of the body, usually the woman can get pregnant.
Okay, so are there any side effects?
Yes, definitely. As with every medication, there are side effects, but nothing major, nothing that should scare you off from adopting this particular method. Some of the side effects that women may encounter when they adopt this method is, one of the very common ones is menstrual irregularity. Some women may say, oh, my flow is not coming as it used to come. It may come quicker than normal. It may come, it may be delayed. And at other times for some women will even say, I'm not even seeing my period at all. So, but like we usually say, whenever you adopt any method, is new to the body. It usually takes the body a while to adopt. So after a while, the body gets used to having it, and some of these may be reversed. So some women may also complain of breast tenderness, headaches, which can easily be treated with over-the-counter analgesics. For some women, there may be change in weight, a mild weight gain. Usually we put that at about 2 to 3 kilograms for a year. So it's not like once you adopt this method, you're afraid I'm going to become obese. No, no, no. The change in weight is actually very mild. So like I said, some women may complain of headaches, some women may complain of nausea, vomiting, but after a while, it just takes a little bit of getting used to, and these symptoms resolve.
Okay. I think we have to take a break now. When we return, we'll discuss more about some of the side effects, because I understand someone wants to know if dizziness and some other. When we come back after the break, we'll touch them. So it's still Contraceptive Matters with DKT in Nigeria, and today we are looking at contraceptive implants with Dr. Tosin Laleye. The implant is one of the hormonal method of child spacing method, and you can actually get or adopt this method by talking to your healthcare provider. It's not like the barrier method and some other emergency pills where you can actually get across the counter. So please stay with us. The program continues in a moment. right, thanks for staying with us. It's still Contraceptive Matters with DKT Nigeria from the stable of DKT Nigeria, and you're watching Lagos Weekend Television. And today we are looking at contraceptive implants with Dr. Tosin Laleye. We've been doing that for the past 15 minutes. I would like our viewers to know that you can log on to www.onionbanana.com if you need to get more information about this particular method we are discussing, or any other method or other brands from the stable of DKT Nigeria. You can also send your SMS to the DKT's toll-free short code. That's by texting RHS space, then you type your question. Type RHS space your question and send it to 38350. It's a toll-free short code, and you get a doctor to call you back immediately your message drops. So please send your message to DKT's toll-free short code by typing RHS space your question to 38350. You can equally call 09072966673 after this program. Any time of the day, you get a doctor to pick your call if you have one or two inquiries to make. So, Dr. Tosin Laleye, we've been talking about implants. I would like you to talk, before we went on that break, we were talking about some of the side effects. Yes. And I asked earlier on, do you experience dizziness also when you're on this this method?
Okay, thank you.
And please hold on, doctor. And you can call the studio line now. Call 0908-729-6673. 0908-729-6673. 0908-729-6673. Please lower the volume of your TV set before you talk. Otherwise, that's the rule of this game. The call is, I know you're calling from your line, which you're paying for, but please lower the volume of your TV set. By doing that, we can actually hear what message or what inquiries you have for us in the studio. So, Dr. Tosin, what are some of the other side effects we have aside from the ones you mentioned?
Well, okay, just like your question asked, and I think one of the viewers sent in a WhatsApp message. Yes, about dizziness. Dizziness is actually one of the side effects that can be encountered with this method, and we can also have abdominal pain. But like I said, with these side effects, they are not expected to last for too long.
Okay,
but if
Doctor, please hold your thought. I think we have a call. Hello, good afternoon. Hello. Hello, I think we lost that call. Okay. Please keep calling. Please keep trying. Hello, good afternoon. Welcome to Contraceptive Matters to DKT Nigeria. Welcome to Contraceptive Matters with DKT Nigeria. What's your name?
Thank you. My name is Olajumoke
Olajumoke
Kadri.
Kadri. Where are you calling from, Olajumoke?
I'm calling from Ifako Agege.
Okay. So, what's your question?
Does this cause multiple births?
Does this particular method multiple births? Okay. Is that all?
Yes.
Is that all you want to know?
Yes, please. Yes, please. That's all you know.
All right. Thank you. All right. I think you need to round up on your talk before you
yes,
touch.
I was saying that dizziness and abdominal pain are also other side effects, but these side effects are not supposed to last for too long. So if after a period of 3 to 6 months, you still find out you're having these side effects, and you find them very disturbing, and they like alter your daily activities, then you may need to go back and you may actually need a change of method, because I've actually met a couple of people who are not able to tolerate certain methods, and then they need to change to another method.
Okay. Hello, good afternoon. Hello. Hello, good afternoon. Hello. Hello, good afternoon.
Hello, good afternoon.
Welcome to the program. What's your name?
My name is Fumi.
Your name is?
Fumi Davis.
Fumi Davis. Did I get that?
Yes, coming from Ikorodu.
Oh, Ikorodu. Fumi Davis. How is Ikorodu this afternoon?
We have to tell you, Ikorodu is very fine.
Okay. What's your question?
Side effect.
Hello?
Hello, side effect.
Hello?
Talking about the side effect.
Can you please speak up a bit? We can hardly hear what you're saying.
Hello, I'm hearing you.
Okay, what's your question? I'm afraid you have to call us back, Fumi Davis from Ikorodu. Please call us back. We did not actually hear what you were saying. We only heard your name. So, doctor,
Yes,
the other caller wants to know about
Okay.
if there's any relationship between this particular
That
method and
method and-
multiple birth.
Okay, there's another
Okay.
call.
Hello, good afternoon.
Good afternoon.
What's your name? Welcome to Contraceptive Matters.
Hello,
Hello, good afternoon. What's your name? Welcome to Contraceptive Matters.
my name is
Yemisi, where are you calling from, Yemisi?
I'm calling from Egbeda.
Egbeda. Thanks for calling. What's your question?
Okay, my question is though, I did the implant last week.
Last week.
Yes.
Okay.
I'm still feeling pain.
You're still feeling pain. Where?
Yes, under the arm.
Under the arm. Is that all?
Yes,
Is the pain very severe?
I did the right zone.
Sorry?
Is the pain very severe?
No, not severe.
Okay, but is the area swollen or anything like that?
It's not problem. The only thing I discovered that when I tied wrapper, I used to feel the pain.
Okay, I think that's because you're yet to get used to that
Okay.
method, and maybe you feel okay, a foreign body is still there.
Yes, it
Maybe
may just
by
be
2
that.
weeks, 3 weeks, 4 weeks. Maybe you should call us back at the end of by the end of December. All right, thank you so much, Yemisi from Egbeda.
Okay, well,
do
it
you want to
shouldn't
add
it
to
shouldn't cause pain. That's why I had to ask, is the area swollen? Maybe there's an inflammation.
a week
But if
ago.
there's no inflammation, I don't think it should cause continuous pain. And then she said when she ties wrapper, I don't know, do you tie the wrapper over your arm? I really didn't get that.
You know, some women are used to doing that when they are at home.
Okay, but it doesn't get to the arm. So,
Okay.
well,
Hello, good afternoon. What's your name? Where are you calling from? Welcome to the show.
My name is Sergeant John. I'm calling from Kurudu.
Your name is
Sergeant John. I'm calling from Kurudu.
Michael John.
Sergeant John.
Sergeant John from Ikorodu. Okay, Sergeant John. Welcome to the show. What's your question? Sergeant John, are you still there? Hello? We lost Sergeant John.
okay, so I'll quickly respond to the first question. He's back.
Hello, good afternoon. Hello?
Hello?
Hello, good afternoon. Welcome to Contraceptive Matters. Hello. Oh, we lost. Hello, good afternoon. You are on. You're on here. Okay. All right.
All right. There is actually no known relationship between this method and multiple births because the mechanism of action for this method is actually that it prevents ovulation. Ovulation is the release of the egg. So if you have a method that prevents the woman from releasing the egg, there's no way it can bring about multiple pregnancies because multiple pregnancies will occur when more than one egg is released and then fertilized.
Okay.
So this method has nothing to do with bringing about multiple pregnancies.
Okay, what about the caller that wants to know why the pain is still there?
Well, yeah, like I was saying, she said when she ties wrapper, does she tie the wrapper over the arm? Like we said, it may just be that she's just being conscious of the fact that something new is in her body. She should give it a week or two, but if it's really very disturbing, please go back to the clinic where it was inserted.
Okay.
Just to rule out any inflammation or infection.
Hello, good afternoon. Welcome to Contraceptive Matters. What's your name?
My name is Kofo from Kurudu.
Kofo from Ikorodu. What's your question?
Please, I've been on IMPLANON since 2011.
That's 6 years ago. Have you changed it?
My next is,
Have you replaced it?
yes, yes.
When did you replace it?
I implanted the second implant. I implanted the second one in 2015.
Okay.
2015. Okay,
The
go
second one
ahead.
is going to expire next year, July.
Okay.
But my tummy is a little bit bigger because I had a flat tummy before. Then my nephew is, although it's not much, but it's like a spotting. But it's
Sporting.
I used to do the nephew for like a month or a month plus.
That's sporting.
So I've been worried about it that hope there is no problem.
Okay. Okay, you want to know why you experience sporting for a
Yes.
whole month?
Yes, for a
Then
month or 6 weeks.
for a month or 6 weeks. Then you also want to know why your tummy is big. How many kids do you have?
I have 3.
3 kids. Okay. Is that all, Kofo? Do you want
Okay, I just want to ask, is the spotting every day?
Yes, it's every day.
Every day, okay. You said you inserted the second one in 2015. When you had the first one on, did you experience the same thing?
It's not up to that. Like 2 weeks and 2 weeks more.
Okay.
Is that all, Kofo?
Yes.
All right. Thanks for calling, Kofo. Okay.
All right. Well, I'll start with the question on spotting. This particular method, like I explained earlier, can bring about menstrual irregularities. Some may complain of, for some women, they don't even see the menses at all. Some see it and the flow is reduced. In some, it is delayed. Well, she is complaining about spotting. Do we have a caller? Okay.
Hello, good afternoon. Welcome to Contraceptive Matters. What's your name?
My name is Sergeant John.
Sergeant John,
Okay.
thanks for calling back. What's your question? Sergeant John, what's your question? Are you there? Oh. Sergeant John, we would love to talk to you. Please call us back. Hello, good afternoon. Welcome to Contraceptive Matters. What's your name?
Yeah, my name is Jeremiah.
Your name is?
Hello, good afternoon.
Good afternoon. What's your name?
My name is Jeremiah.
Your name is General Badamosi Nofio. Okay.
Yes, nothing.
Nofio. Where are you calling from?
I'm calling from Ikorodu.
Oh, Ikorodu. I think we have more people calling.
Ikorodu.
Okay. What's your question, Badamosi? Hello? Are you there, Badamosi? Wow. Please call us back, Sergeant John, Badamosi, and Fumi Davis. Hello, good afternoon.
Hello, good afternoon. It's Yetunde.
Yetunde. Where are you calling from, Yetunde? Oh.
Okay. And since this is something new, you've used the method once before and you did not experience this, I would advise that you visit your healthcare provider so that they can check you to rule out other reasons why you may be spotting every day.
Okay.
Because you've used this method before and it wasn't like that. So it's good to rule out other causes of this.
Hello, good afternoon. Hello. Hello, good afternoon. Hello, are you there? Okay. Kofo also wants to know why she has a big tummy after
Okay.
3 kids.
Well, I'm really happy you asked how many kids she has had.
Okay.
The truth about the matter is that is one thing a lot of women
Okay.
battle
Please
with.
hold your thought, doctor. Hello, good afternoon. Welcome to Contraceptive Matters. What's your name?
Please
Please
switch
lower
down-
please
switch-
lower the volume
lower
of
the
your
volume.
TV set.
Oh, you switch it off.
Adebayo, please lower the
TV.
volume of your TV set, or we have to let you go. You cannot do 2 things at a time.
It's better now.
Have you done that?
Yes.
We can still hear your TV set. Okay.
Yes, a lot of us still wish that we had that very flat tummy we had before we started having babies. The truth is, once we get pregnant and the uterus expands, causing the abdomen in general to expand, even after giving birth, it doesn't go right back that way. But these days, with eating right, eating the right foods and exercise, you can actually achieve your flat tummy. So I would advise that you watch what you eat
Hello, good
and
afternoon.
exercise. I can hear
Hello, please
myself.
lower your hello, please lower the volume of your TV set.
The TV is still
Please,
very
we
loud.
cannot talk to you while the volume of your TV set is at a high pitch. So please lower the volume of your TV set. That's the first rule. Lower the volume of your TV set if you truly want to talk to us. If you truly want to talk to us, please lower the volume of your TV set. So, doctor, you were talking about the
Yes, about the flat tummy. I was saying that with the right diet, that is cutting down on a lot of carbs. Carbs are things like rice. A lot of us, we eat rice every day. Trust me, if you eat rice every day, whether or not you've been pregnant before you know it, you will start seeing some changes in your body. So cut down on all the yam, rice, gari, eba, and all of that. And with adequate exercise, you should be able to achieve a flat tummy. It may not be as flat as your pre-pregnant state, but at least it will be flatter than what you have now.
Hello, good afternoon.
Hello.
Hello, good afternoon. Welcome to Contraceptive Matters.
Good afternoon.
Good afternoon. What's your name?
My name is Bola.
Bola, where are you calling from?
I'm calling from my 12.
My 12. Bola, thanks for calling. What's your question?
My question is,
Are you thinking about your question, Bola? I think you have to gather your thoughts before you call us on the show. Please gather your thoughts because we have lots of viewers trying to get into the studio. Hello, good afternoon.
good afternoon.
Good afternoon. Welcome to the show. What's your name?
My name is Aisha.
Aisha, where are you calling from? Oh, Aisha, please
going
call
on?
us back. I think we have lots of people trying to call in at the same time. Please call 0908 729 6673. 0908 729 6673 or log on to www.onionbanana.com. We cannot receive WhatsApp messages today because the network is bad. So please, we've stopped receiving WhatsApp messages anyway. So please call 0908 729 6673. Hello, good afternoon. What's your name and where are you calling from? Your name is
Alimo.
Alimat. What's your question? Alimat, are you still there? Hello, Alimat. I'm afraid Hello, good afternoon.
Good afternoon.
What's your name and your question? Welcome to the show.
Yesterday is my name.
Okay. Okay, Yesunde from Jakonde Esedikpaja. What's your question? Thanks for calling.
My question is that there's a lady that makes do coils.
Okay, that's the
Family
IUD.
planning.
Okay.
Yes. But since then, when she removed it, the period was being scatter somehow. It's not coming every time.
Okay.
So what can she do?
Okay, how old is this lady?
The lady is 38 years.
38. Okay.
Yes.
All
Is
right.
she now approaching menopause?
Well, not quite.
Not
Not
quite.
really.
Okay. All right. Thanks for calling yesterday. Is that all?
Yes.
All right.
Thank you.
All right. Okay. Do you want to respond to that quickly?
Well, the truth of the matter is that a lot of women on the IUD actually even complain of the menses coming out a lot more. It's not one of the methods that should make the menstruation cease or make it scanty. Well, like we say, different women react to different things in different ways. What I would just say is that there could be other reasons why that is happening. So I would advise that she visits the hospital so that she can be properly investigated as to know the root cause of why that is happening. She has taken out the IUD, so I don't think it should have that kind of effect.
Hello, good afternoon. Hello, good afternoon. Hello. Hello, are you there? Hello. Hello, good afternoon. Oh, okay, so doctor, please let's finish up with the side effects because we were still talking about side effects before we had the calls.
Okay, yeah, I was just emphasizing on the fact that weight gain is not something major, so it shouldn't scare anyone off this method.
Okay. Hello, doctor, please hold your thought. Hello, good afternoon.
Hello?
Hello,
Yeah,
good
good
afternoon.
afternoon.
Welcome to the show.
My name is Harrison.
Your name is
Harrison.
Harrison. What's your question, Harrison?
My question is, what will you do if you have a snake bite?
What will you do if you have a snake bite? Did I get you right?
That's a question.
Okay, Harrison, thanks for calling. Hello, good afternoon.
No, I'll answer her question.
Yes,
even
I
though it's
want,
not-
but I think we have another call. Hello, good afternoon. Okay.
No,
I
okay.
need you to round up on the side effect before you
Okay.
touch the snake bite.
All right,
issue.
so weight gain, which is expected to be just about 2 to 3 kg in 1 year. And if you eat right and try to exercise, you are not likely to gain any weight that you do not need. And okay, I've also mentioned headache, breast tenderness. So like I said, they are not major things. But if you see that you are having these symptoms and they are very disturbing and they are persistent, they are not abating, you need to go back to the health facility to complain.
Okay, Harrison wants to know about snake bites.
Okay, if you are bitten by a snake, all I can say is that please go to the hospital because you need to be given an antivenom for that. Because the bite from some snakes is actually, some snakes are poisonous and one could die from the poison. So you need to visit a hospital if you've been bitten by a snake.
Hello, good afternoon. Hello. Hello, good afternoon. Hello, good afternoon. Welcome to Contraceptive Matters. Hello. I think we lost that call. Please call 0908-729-6673. I think we can still pick 1 or 2 calls before we round off the show. Or visit www.oniandbanana.com for different methods about child spacing method. We have different information about each of these methods on the website. Or you send your question to DKT's toll-free short code. That's 38350 by sending RHS space your question to 350 by typing RHS from your phone space before the question to 38350. Type RHS space your question to 38350. So, Dr. Tosin Lale, what's your final thoughts on implant before we round off today's show?
Okay. We've said a lot of things about implant today, but I would just love to emphasize the fact that the implant is actually very convenient. And one of the very good things about it is the fact that it is reliable, 99.9% reliable, and it is easily reversible. There is no delay in return to fertility for any woman that adopts this method. So once you are ready to have a baby and you take it out, you are good to go. You don't need to worry about residual amounts of the hormone from this particular method being left in your body. So you can relax and know that there's nothing to worry about.
All right, you've heard Dr. Tosin Lale. You're ready to go after you must have decided, okay, I think I'm ready to have another baby. But just make sure you seek your healthcare provider's advice before you adopt that method. Seek your healthcare provider's advice before you adopt that method. Don't say because Mrs. A is on that method, you're going to adopt that method. Seek your doctor's advice. We've been discussing implants, and I am Olasumbo Mudupe. This program has been made possible by DKT Nigeria, one of the largest and private providers of reproductive health products in the country. I'm Olasumbo Mudupe once again. Thanks for watching, and please join us again next week when we talk about another form of modern child spacing method. Bye-bye.